You all know that international forum is conducted daily. We are conducting here 3 sessions. One in Hindi from 7 to 8, and from 8 to 9 we have international session in English, and from 9 to 10 we have a local language session in Malayalam. So all those means that a lot of presentation in those 1,245 days. So today we get a wonderful guest in Prof.Dr SHITAL SHAH. She has completed her MD in homeopathic pharmacy and is working as the HOD at the Department of Pharmacy, Ahmedabad Homeopathic Medical College. And she has an experience of 25 years in practice and 29 years in teaching experience. That is something great as far as her efficiency is concerned. She has completed her PhD very recently, and that subject was PCOD. And today she will also be discussing about PCOD also. And she has another PG diploma in IFPH in difficult cases from Greece. And another thing about her is she is highly qualified and experienced homeopathy practitioner with a distinguished educational background, MD, PhD, PG, IAH, and a e-learning course for 2 years from International Academy of Classical Homeopathy, Greece. And as a professor, she is has a teaching experience of 29 years, and was the head and professor in homeopathic pharmacy at Ahmedabad Medical College. She has guided many undergraduate and postgraduate students. She, as you all know, being a teacher, they have to become examiners, conducting various activities in college. She is is there in the selecting committee for professor selection in different colleges, and recognizing her remarkable 25 years of journey of hard work, passion, and contribution. She has a certificate of appreciation from Paul University. And some of her achievement is she has written a lot of presentation and mechanism of cure, how remedy act in new life era of homeopathic in homeopathic journal, a case of Dutchman Baker syndrome and homeopathic heritage, a role of technology of hormonal imbalance in Divi Shaker newspaper. So many presentation. And as a practitioner, she has 29 years of tenure in the field of homeopathy, and she has treated 10,000 plus patients. So she has treated long-lasting and threatening diseases like female disorders. And she is a prominent practitioner who is dedicatedly specialized in PCOD in Gujarat. That's why this is all about her, our beloved guest. And
Dr. Shital is trying to enter, but she's not able to join it.
No problem, sir. Emphasizing the patient's central approach, and dedicated team of acute homeopathy clinic is committed to enhancing our well-being and promoting long-term health. She is a health promoter as well as health mentor. She has been doing a lot of public activity in making, promoting as well as promoting homeopathy to great levels. So today we will have a discussion, and she will be presenting a paper, role of homeopathic medicine in PCOD case. As you all know that this is one of the important area where you are getting homeopathic doctors are getting a lot of cases day by day, and even from the teenage to the menopausal age, we get such cases of PCOD. Of course, we all know that there are hormonal imbalance is one of the basic problem. But frankly, as a homeopath, what we saw in front of us is that most of the cases are due to these most of the cases, there will be a mental trauma or a mental stress that may be behind the reason. Why nowadays a lot of young people are getting, particularly teenagers are getting this PCOD? The reason may be their lifestyle. The lifestyle, this is one of the reason for PCOD. Lifestyle problems are one of the main reason for PCOD, I think, because a lot of, from the very young age, people used to take a lot of non-vegetarian diet, and they are taking a lot of food and taking and not bothered about exercise. Nobody is simply sitting in the home and just watching television or mobile and even cartoons, and that may be the reason. One of the thing, and as you all know, now the families are not as big as in the early days. Nowadays, nuclear families are one of the reason where because a lot of people, whenever there is a lot of members in the family, people used to get a chance to interact in between. But unfortunately, nowadays we are not getting such patients, not such an atmosphere in the home, and that may be the reason why such a thing happens nowadays. I think Sahani sir could explain some more reasons. As you all know, that stress, there are clashes going on because patients, even a family member, the husband has no time to care the wife, and the wife has not care time, not getting proper time to care the husband, or sometimes the family members, particularly the children, are not getting the proper care from parents. They are always busy with their day-to-day life, particularly official work. So these are the thing.
जूम
These
ऐप
are
अपडेट नहीं है मोबाइल से मैडम का
these are the things that may be the reason for PCOD. We have a lot of presentation in this forum about PCOD. As you all know, sometimes as you accidentally, when you get a patient of PCOD, when you examine with the USG, you may find that the ovaries, sometimes most of the ovaries are affected.
Doctor,
Yes, sir.
Dr. Ganesh, she has joined.
Yes, sir.
Kindly make her the co-host.
Yes, sir. Please ask her to raise the hand, sir.
अभी आप वीडियो को क्लिक कीजिए ना तो आ जाएगा
रोशनी शाह, डॉक्टर
आप इस पे अभी आएगा
Yes, sir.
She has joined in the name of Shital Shah. The video is there. Unmute कर लीजिए, आप unmute कर लीजिए.
Yes. Yes, sir. I shall. Okay. Okay, I shall make her co-host. Okay, sir. I shall make her go. And good evening, Dr. Shital Shah. Already we have introduced you into the forum, and unfortunately, due to the technical problem, you may not be you are not able to connect with us. And so, as you all know, that today's subject is PC. You are talking about PCOD, the role of homeopathic medicine in PCOD cases, and of course, you are one of the person who has a PhD in PCOD cases. So we proudly welcome you back into our forum, and you can begin the session now. Welcome, madam.
Yes. Good evening, all students.
Good evening, madam. Is here we have homeopathy students, homeopathy doctors, as well as homeopathy lovers. So you can begin your session now.
Yes, sir. I can begin my session, but I would like to say that can you show the PPT? I will. Means from your side. Shall I send the PPT? Or I can the PPT shall I send you, because I don't know how to share from this.
Oh, okay. You may send to Sahani sir now, so that
no, sir. I'll be leaving.
So you may,
I will forward it to you. I will forward it to you.
Okay.
Otherwise, I will send the PPT afterwards.
okay, you may send it now, and then you may begin the session so that we will share from some.
Okay.
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 Since the doctor's number was with not with me, I couldn't contact directly.
Sir, I have sent you the number. I have sent you the mobile number. Dr. Dinesh, I have sent you the mobile number of Shital Shah. You can talk to her.
Hello.
Yes, doctor.
Okay. Sir, can you just send me your mail ID, please? I can share you the PPT.
Yes.
Then in the WhatsApp, can you just share me the mail ID?
Just now I have sent you the email ID of Dr. Dinesh.
Yes.
Everyone, please wait. Some due to some technical problem, we are waiting for the PPT to share. So,
Sir, I have sent it you, the PPT.
Madam, you may begin the session. You can talk
Yes.
in between. Our Dr. Hibat will be sharing the same.
No
Okay.
problem. No problem. No problem. Okay. Good evening, students. Myself, Dr. Shital Shah, and today I would like to explain about role of homeopathic medicines in PCOD with the cases. Can any student tell me hi or anything so I can feel relaxed that you are listening to me?
Yes, madam, we are all
Yes.
listening, but don't worry about all the things. You may carry on because our time, we have already covered lost 20 minutes in between.
Sure.
That means you will be getting only 30 minutes for presentation. So you may please begin the session.
Yes. See, first of all, I would like to explain about the PCOD, that what is PCOD and what is the diagnostic criteria for the PCOD. Now, as we are homeopath, always there will be a question that whether we should know the allied subject, we should understand the allied subject or not. But when you read the Materia Medica, the important thing is the symptoms which has been written in the Materia Medica. The diagnostic criteria has been not written in the Materia Medica. So when we read Materia, we have to differentiate the common symptoms as well as the unique symptom of that drug. Unique symptoms means individualistic symptoms on which we are prescribing a medicine. To understand the individual symptom, unique symptom of each and every drug, first we should understand the disease. So the sphere of action is very important. And to know the sphere of action, we have to understand the disease, and we are starting with the disease. Now, PCOD, I have selected this PCOD as it is a burning issue today. There are special diagnostic institute. It is a endocrinology as well as a gynecological disease. So there are special institute who are diagnosing the PCOD. The name of that institute are National Institute of a Child and Human Development, European Society for Human Reproduction and Embryology, American Society for Reproductive Medicine, Androgen Access Society, modified Rotterdam criteria. So these are the committees about to diagnose the PCOD as a disease. Now, today I would like to discuss the criteria about Rotterdam. So according to Rotterdam criteria, the diagnosis of the PCOD involves biochemical evidence of hyperandrogenism and clinical evidence of a hyperandrogenism. Now, I have taken both the things, biochemical and the clinical. Now, clinical evidence means, have you seen that in the PCOD girls, there are always an unwanted hair on the face, unwanted hair on the chest, and unwanted hair on the abdomen. So all this has been diagnosed with the Ferryman-Galway score. So that is known as clinical evidence of a hyperandrogenism, and that is hirsutism. But biochemical evidence of a hyperandrogenism is done by the testosterone level. So in the PCOD female, the testosterone has been increased, and at the same time, the clinical evidence symptoms are hirsutism. Second is oligoanovulation. The oligoanovulation means oligomenorrhea will start. That means the menses will become irregular and the periods will be more from 35 to 40 days. That as the disease progresses, as the disease is advancing, it is called with the amenorrhea. When it reaches to the amenorrhea, 3 months, 4 months, 6 months, the girl as well as the female is not having the periods, and that is known as oligoanovulation. In the PCOD girls or the woman, the luteinizing hormone is elevated, and the luteinizing hormone is always in a constant steady rate. So the ovulation is not taking place, because ovulation can only occur when the LH or the luteinizing hormone comes with a surge. So no surge, no pulsatile rhythm occurs in the PCOD female, and that's why there is no ovulation in the PCOD girl. Third is ovarian morphology. Every month, the normal, as you know, the normal menstrual cycle, every month, the one follicle matures to its maximum size, that is 20 mm, and estrogen sends the signal to the pituitary, to the hypothalamus, to secrete LH hormone. And as LH hormone comes, there will be a broken of an ovum, and then ovulation starts, and there is a secretion of the progesterone and everything, and there will be a normal cycle. But in PCOD female, what happens? In the mid-follicular phase, because of the LH secretion is more, the ovum could not reach to its maximum size, and small follicles remain inside the ovary, and that makes the ovary thicker and thicker. So that is the ovarian morphology, where more than 20 follicles in each ovary, and the ovarian volume, if there is a 10 cc, then it has been diagnosed as a PCOD. So 3 major criteria: biochemical, clinical evidence of hyperandrogenism, oligoanovulation, and ovarian morphology. These are the three diagnostic criteria for the PCOD. Now, why nowadays the PCOD is more? The pathophysiology is uncertain, but there are certain reasons which can produce, or there are certain factors which affects the GnRH hormone and insulin resistant. So the genetics or increased GnRH pulse frequency, LH level, defective aromatization, elevated circular estradiol, decreased production of HSBG, enlarged ovaries, impaired interaction between signaling pathways with the FSH and insulin like growth factor, hyperechogenic ovarian stroma, ovarian hypertrichosis, and the genetics. This all are the causative factors which produce abnormalities of the GnRH. When the GnRH has been disturbed, that disturbed the secretion of the luteinizing hormone, which is secreted by the pituitary, and that LH hormone, which is disturbed, which in turn increases the androgen level in the ovary, and that increased androgen level is main causative factor to produce imbalance of the hormones and start a PCOD as a disease. Because of our lifestyle, because of our unhealthy diet, nowadays insulin resistance has been increased. I should not forget the mobiles. So this all are the culprit to produce insulin resistant. So that is insulin signaling pathway abnormalities, dyslipidemia, X syndrome, hyperinsulinemia, insulin resistant syndrome, beta cell dysfunction, post receptor defect, decrease in insulin receptor. All these are the causative factor or the pathophysiology which increases the insulin resistance, which in turn producing PCOD, ovarian immature follicles. Now, there will be a question that being a homeopath, there is a need to understand all the disease. Then it is yes. Being a homeopath, we have to understand the pathophysiology in detail, as it helps to understand the sphere of action. Dr. Kant says that we should
Madam, we
yes.
have started screen sharing. Can you see?
Yes, sir. Yes, sir. Thank you.
Yes. Okay.
Thank you. So, Dr. Kant has written the Materia Medica. I would suggest all the students to read the preface of the Kant Materia Medica. And on the first page, he told us that the whole Materia Medica is based on symptoms of the prover. Prover are not doctors, but the prover has given the symptoms. So there are certain Materia Medicas which will show you the exact pathophysiology of the disease. Being a homeopath, we have to understand the pathophysiology of each and every disease and then go back to the Kent Materia Medica, read Materia Medica, and differentiate that, oh, this symptom is of the PCOD. So this is the way we have to understand the pathophysiology, which is very important. Now the symptoms. The symptoms of the PCOD are hirsutism, android obesity, acne, irregular bleeding, amenorrhea, acanthosis nigricans. Now, acanthosis nigricans and android obesity, these are the symptoms which is associated with the insulin resistant. But if only the GnRH abnormality will be there, that girl will have the symptoms of a hirsutism, acne, irregular bleeding, and amenorrhea. As I am a homeopath, now I will say something about a homeopathic point of view PCOD. As we know that there is always a predisposition factor. Without a predisposition factor, no disease can start in a human being. According to Hahnemann, chronic disease always starts from the inward, and the acute disease, it will start from the external manifestations. But PCOD is considered as a chronic disease, and the causative factor is SORA, psychotic, and syphilitic. So the polycystic ovarian disease is a chronic disease, and the treatment should be done according to the concept of a Hahnemann for the treatment of the chronic disease. Hahnemann sir has told very nicely that the chronic disease is a disease that has a special tendency of ever continuing. Now, see, this is very important. Suppose you have acne and you are going to the allopathic, you are taking tube, then it goes inside, and then it starts with the another symptom. So chronic disease just changes the organ, just changes the symptoms of a disease, but it is an everlasting. So it is a continuing through in a different forms unless and until removed, only and only unless and until removed by the aid of the effective constitutional homeopathic medicines. Students, never treat a chronic disease with the symptoms of an expression just with an acute remedy. There will be a biggest failure when we give a medicine on the acute symptoms. You should always use a deeper acting remedy and see the wonders of the homeopathic science which has been given by Dr. Hahnemann sir. So chronic disease is a disease that has a special tendency of ever continuing, though in different forms, unless and until removed by the aid of the effective medicines. That means the true cure does not lie in a mere removal of the disease symptoms or in their transfer from one organ to another, but annihilating the tendency by restoring the deranged by restoring the deranged resistant power. Now, without a latent sora, that could not be disease. Then how the latent sora is producing in our body? So today's era, the education stress, inactive lifestyle, sibling jealousy, some stress, heart disappointments means breaking of a heart, overuse of a technology, mobiles, laptops, junk food, nuclear family, sexual harassment. All these are the causative factors which produce continuous thought process in the mind that has been given by Dr. Hahnemann in an Allen chronic disease, that is evil thinking. So always the first evil thinking comes in our life, and that remains as a passive thinking for a long period of a time. Now this passive thinking will become as an active thinking, and that is a predisposition soil in each and every person that is known as a latent sora. Now this latent sora will start a disease. This latent sora, when becomes active, the disease starts. The first symptom will appear, that will be acne. Then that the patient could not understand, they go to the doctors and they use ointment and just suppress the acne, and that will produce, goes inside, and that will produce the psychotic miasm will join with the latent sora, and that will convert it into imbalance of the hypothalamic and imbalance of the hormones and androgen excess. So the patient will start, or the girl will start from the second symptoms, that is acne, irregular period. Still, they are not understanding and they are going to the gynecologist. They are taking pills, hormonal pills. Now, what does the hormonal pills do? That hormonal pills do the action of the ovary. So previously the ovaries were producing the hormones and regulating the normal menstrual cycle, but now they are not treating the ovary, but they are giving extra help to the ovary by giving pills. So ovary goes to atrophy, and here the menses will become normal and the girl will be satisfied that, oh, my periods are normal. So one day when a time comes, she will go to the infertility, because now atrophy ovarian has been started. So see, can you understand? The girls, because of all these factors, the evil thinking starts, and this evil thinking goes actively from passive to active thinking, and that leads to sora, psychotic miasm, and then at the end infertility, ovarian atrophy, and that is antisyphilitic miasm. So if you want to become a great homeopath, you should select a homeopathic medicine which should base mental picture, and on that mental picture, along with the generals, we should select a medicine and we should prescribe a medicine to the PCOD girls. I request all my students, never prescribe a medicine on the basis of
Some technical network problem is there, I think. We couldn't clearly hear you, madam, now. Dr. Hibbert, can you hear now? Dr. Hibbert, can you hear?
Yes, I can hear.
Left, I think. She due to the poor network connection.
Can you see this?
Yes, we can see the screen sharing. Everything is there.
Oh, but
But
she's out. I think that he might have.
she lost her connection,
left.
I think.
Okay.
Let's just wait. Unfortunately, I didn't have her number before, so that's why these things happen. If I could have the same, yes, no, she has not joined. Let me call her, please.
I think that she joined.
We can wait. I am calling her. Yes, yes.
Yeah, she's joined.
Shah Sheetal.
Yeah.
Yes. Please unmute. Please unmute, madam. Okay, you can go ahead with.
Okay, sir. Shall I continue?
Yeah.
Yes, definitely you can continue from where
Yes.
we lost some of your lines just before stopping. So
Shall I repeat?
Yes.
Okay. So we have started with that never treat a PCOD patient as it is a chronic disease. So never treat PCOD patients with the acute medicines. Always treat the patients with the chronic medicines according to the Hahnemannian criteria. Now, Hahnemannian criteria to treat a disease is always you should take a case. After a case taking, you have to remove the disease symptoms, and on the basis of the individual to the you have to reach to the
Still there is some problem, madam. Dr. Hiba?
Yes. That's the problem.
And
Yeah,
madam,
it is.
network is not supporting
Yeah. That is the problem.
properly.
But I think that she is continuing, but we
Yes,
cannot
sir.
hear.
Yes, I shall call her. We don't have another number, only just. Yes, she left. She lost her connection once again. Let us wait till she joins. She was telling that the proper case taking as well as chronic never prescribe a single remedy before you confirm the patient. Whether the reasons behind the illness, you got all those things. But usually we may start up giving just some acute medicine even without confirming the remedy. But being a PhD scholar and she know a lot of experience she had a lot of experience in this field. That's why she's talking in that way. Anyway, her presentation is really excellent, but unfortunately we are not getting a proper connectivity of the same, continuity of the same also. If we lost this day, don't worry, bother about that. We will get, we can ask her to make some more presentation on the same subject in the coming days with the laptop from some other part. Her net, I think she had joined from mobile network. That may be the reason. Am I right, Dr. Hibot?
Maybe.
She's trying to join, but she has not yet joined.
I think that she may be from a remote place, isn't it?
She's busy now. She's trying.
Mm.
We can ask her to join from some other mobile. Oh, so that's. I think there is no phone. It is already stating that the number is switched off.
We can hear some voices coming from here and then.
That is
Is
from
it
my
from?
phone, and that's for my phone. I was calling her,
Okay,
and
okay.
the network saying that her connectivity, the phone itself is switched off. That means sometimes there may not be enough charge inside. Maybe that, or otherwise, sometimes it may be due to uh, network problem. I am trying to call her. I think you can show slides one by one.
Yeah,
So
yeah, yeah.
that
I think that that is good.
so that people can.
Diagnostic
Yes,
criteria for PCOD.
you can read
Specialist
also.
Okay. This is
No, no.
uh,
Yes, you can read also. So that
according to the Rotterdam criteria, the diagnosis of PCOD involves biochemical evidence of hyperandrogenism assessed through total serum testosterone levels. Clinical evidence of hyperandrogenism evaluated by the Ferryman-Galway score measuring hirsutism. The other two criteria include oligoanovulation, characterized by irregular menstrual cycles, prolonged cycles lasting more than 30 days, 35 days, or amenorrhea persisting for more than 3 months and occurring less than 8 cycles. Ovarian morphology, evident in sonography, which shows more than 20 follicles in each every ovary or an ovarian volume exceeding 10 cc. Pathophysiology. I just say one incident in my life. One girl came to me for a big abdomen. I suspect that it may be she might have pregnant because she is 17 years old. She was a student. That time, another doctor, on MBBS doctor nearby, said that she sent her. So they came to me and I told her to take a, because I suspect whether it is a illegitimate pregnancy or something like that. So I sent her to take a scan. That time I saw that 3.5 liters of fluid, the ovary become a large one extended towards the sternal and that much bigger one ovary. So I told her to directly you go to, don't come to your home, directly go to the hospital and make a surgery, immediate surgery. And it was did. And one ovary lost and the other ovary was active and she again pregnant. Her marriage, after some years, her marriage was happened and she had 2 children. And I saw her nowadays, but that may be one of the, we cannot even expect such a growth of ovary. 3.5 liters of collection in the ovary, it became a big organ. So I don't know whether how it is happened. So that is another thing. Just I want to say this. This is one of my experience. It was taken, I think that 10, 15 years back. Your pathophysiology, abnormalities of GnRH, insulin resistance. Increased GnRH pulse frequency, increased LH level, defensive achromatization, elevated circulatory estradiol, decreased production of SHBG, enlarged ovaries, impaired interaction between signaling pathways with FSH and insulin-like growth factor, hyperechoic ovarian stroma, ovarian hierothicosis. genetics. Insulin resistant. Insulin signaling pathway abnormalities, dyslipidemia, X syndrome, hyperinsulinemia, insulin resistance syndrome, B cell dysfunction, beta cell dysfunction, post-receptor defect, decreased insulin in receptor. This is a pathophysiology of the conditions. Androgen excess. This is one of the in condition in PCOD. Mild follicular phase is affected, which leads to immature growth of follicles. Premature follicular phase is affected, which leads to activation of LH secreted granulosa cells that cause immature growth of follicles. Symptoms. These are the symptoms. Hirsutism, hair here and there on the face. The acne, irregular bleeding, amenorrhea, android obesity, acanthosis nigricans. Thoracic psychosis, miasmatic, hirsutism, android obesity, acne, irregular bleeding, amenorrhea, acanthosis nigricans. Polycystic ovarian disease is a chronic disease. Polycystic ovarian disease is a chronic disease. The treatment should be done according to the concept of Hahnemann for the treatment of chronic disease. Definition: chronic disease is a disease that has a special tendency of, that is the part. Evil thinking, passive thinking, active thinking, latent disorder. Education stress, inactive lifestyle, sibling jealousy, stress, heartbreaks, overuse of technology, junk food, nuclear family, and harassment. Just a minute.
Hello.
Yes,
Shall I
madam.
start?
Yes, madam. You can continue the session. Dr. Hibbert was reading your.
So sweet of you. Now I'm starting with continuing with my remaining part.
Okay, continue, madam.
Okay. So I'm going back. Yes. So all these are the causative factors which affects the mind. And according to Hahnemann, sir, the mind is a culprit to which starts with the latent disorder. So the modern name of a latent disorder is predisposition. So predisposition, how the predisposition soil and how the hereditary and the chronic disease starts. So all these factors to produce evil thinking, which remains for some period of a time, that is known as a passive thinking, and then that passive thinking will convert into active thinking, and that active thinking will produce a latent disorder. So that latent disorder will be the first thing to start a symptom, and that is acne. So latent disorder, when becomes active, the disease starts. That is the first step to start the chronic disease. The nosological name are changing according to the modern science, but the homeopathic concept for the chronic disease is always the disease starts from the latent disorder. The sora is considered as a mother of all the chronic disease. If there is no sora, there will be no psychosis, no syphilitic, which can start a disease. So the latent sora will appear and it will produce a disease that is acne. After now, as we know that we are using a cream and applied and taking an allopathic treatment, so that allopathic treatment will suppress the skin, the language of the latent sora, and then there will be irregular menses, disturbed menses, and then androgen excess. So now psychosis has joined to the latent sora and it will become a sora psychotic disease. Now the girls goes to the doctors and the gynecologist will prescribe a pill, hormonal pill. So role of the hormonal pills are they will make a artificial ovary. So the work the ovary which was doing, that same work will be done by the pills, and the girls are satisfied that we have a normal menstrual cycle. But at the same time, the ovary goes to the failure and there will be an atrophy of a ovary. So such type of the sora has been added with the psychosis and the ovarian atrophy, that is infertility. So sora, psycho, and syphilitic. So we have to treat the patients with the constitutional medicines, deeper acting chronic medicines, which touches to the psycho-syphilitic aspect, and we can remove the PCOD from the patients. Now, I would like to share some of my cases, and the cases which I'm representing over here have the testimonial on the YouTube. So you can just search Acute Homeo Clinic and you can see the testimonials of my patients. My first patient is Subhangini Goswami. Her age is 20 years. She is single and she had a disturbed menses. The periods are not regular and the menses is lasting only on 1 or 2 days. Now, the commonest that thing is that the PCOD females will always have a scanty menses, and mostly some of the female suffer from the spotting. In that case also, don't prescribe any acute medicine, but always prescribe a chronic drug. The past history, she had neonatal jaundice, chickenpox, and severe pain in the stomach. At that time, she was diagnosed with the enlarged ovaries. The family history, her father was suffering from a gout and the renal stone, mother, rheumatism, as well as PCOD. The grandfather, heart disease, maternal side, means Nana Nani, diabetes, and her aunt, that means Foy, that was also suffering from the PCOD. The mental picture, which is very important, or the mental history. She was born and brought up in Gandhinagar, and the father is in the GEB, and mother is a principal. Now, see, the story has been started. They were two daughters, means she had one younger sister, and the mother is very ambitious. Mother is a principal in one college, and father is also on a big post, means on in the GEB. So father had a transferable job, and so she has to. The brought up is with her mother, but the mother has a busy schedule. The child or my patient could not get enough time. Mother is very fastidious, wants each and everything in a proper place. Whenever my patient wants to talk with her or want to show some achievement or need some time, but the mother is always busy, and at the same time mother is also very fastidious, so she could not give enough time, and that has affected to my patient. And at the same time, the father is also very busy and the disease has been started. Every day all type of the conflicts was there. Mother always scolds her, never understand her, she weeps alone, and that the emotions has been suppressed. One day she had made a nice cake for her father on the Father's Day, but that day also, because her younger sister, she is very weak, father and mother had taken care of her and she is not even appreciated. So that all is affected, and she had started a disease, that is irregular periods. The totality of the symptoms on which we have prescribed a medicine that is sensitive, oversensitive, emotional to the reprimands, disappointed love, here the disappointed love from the parents, delusion that she has been neglected, loneliness, brooding, menses absent. She had an aversion to fish. Now she is not eating the non-veg, but she had a strong aversion to fish smell. As a best friend, she loves to eat non-veg. She could not bear the smell of the fish. Food, she eyes desire and desire for salty food. On this basis, we have made a repertorization sheet and we have prescribed a medicine that is Netramure. So Netramure 1 m has been prescribed and you can see the results. Here, we have the pathological results. This is an hirsutism chart and the pathological results you can see. Now see, one important thing in the PCOD female, always they have a disturbed FSH and LH ratio. The diagnostic criteria, always LH is more high in the PCOD female. So after the prescription of the Netramure, the ratio between FSH and LH has become normal. So 1:1, that is an ideal to produce a normal menstrual cycles.
Madam, I think our time is about to finish and we can have some of your presentation in the future so that you can come out with a laptop and make the remaining part of the same in the second edition of your presentation.
Thank
Uh,
you, sir.
since-
Anyone have a question? Then, if anyone had a question, then I can give the answer, or we can stop.
Yes, madam, we have usually we have 20 minutes of discussion in between, but unfortunately we lost a lot of time in the presentation, and I hope we can extend our session to some other convenient date for you, so that we can fix a date in February, and
Thank you, sir.
at that time we can have discussion. I think. It is the time to wind up the session. I invited Dr. Hibbert to
No.
say a lot of things to the session.
Thank you.
A
Thank you,
lot
sir.
of people want to have interaction, but the time is one of the things because we have another session coming exactly at 9 p.m. Our sessions are really from 7 to 8 we have a Hindi session, and from 8 to 9 we have international session in English, and from 9 to 10 we have our Malayalam session. So we cannot extend so much of time. So
Thank you. Thank you, sir. Thank you.
we will arrange another session for you, madam, as
Thank
early
you.
as possible, because your presentation was really excellent, and it shows the need of the hour is that everyone have the basic knowledge about this disease, and how to trace the case and how to find the remedy. As you rightly pointed out, you have pointed out here that one never prescribe a medicine when you get in a acute problem as far as a PCOD case itself. You just have to go into the details and find out the
Yes.
remedy.
Yes.
This is what we get from your presentation.
Thank you, sir. Thank you.
Okay, 1 minute before going to Dr. Hibbert, I think we can give 1 minute to Dr. Ramparesh. Yes,
Okay.
Dr. Ramparesh, sir.
Thank you, Dr. Shital, Madam. Very
Thank you,
nice
sir.
presentation. PCOD, excellent session, but disturbance of networking, your network. Thank you, Shital Shah, and thank you, Dishilva. Dishilva is a presentation of session.
Yes,
Thank
sir.
you, दोनों को thank you. Very nice, very nice.
Thank you,
Thank
sir. Thank you. Thank you very much. Thank you.
Thank you. Okay.
And
Thank
now now it's up to Dr. Hibbert to say what thanks to the session. Please unmute, Doctor. Please unmute. Please unmute. You are muted. Dr. Hibbert.
It was a very nice presentation, and we are very much eager to know from you because of your powerful, energetic voice. Immediately
Thank
you
you, sir.
changed from the the PowerPoint presentation to the class. Yeah, you are such a person like you. We are always welcome such eminent personalities are in our way. So we are very
Thank you,
much
sir.
happy to hear you from
Thank
you, and we are welcoming you. Thank you very much. Thank you all.
Thank you, sir. Thank you.
Thank you, Doctor.
Thank you. Thank you.
With that, we come to the day 1246, and tomorrow we will have a presentation from Dr. Kulban Singh, and he will be discussing about benign prostatic hyperplasia and homeopathy part 2. Last week, sir has presented the first part, and tomorrow we will have the second part.
Shall I leave, sir? Shall I leave?
Yes, madam. You can
Yes,
be.
yes. Okay. Thank you. Thank you, sir.